In the previous discussion, we have understood how to determine heart rate and rhythm. Now we come to axis determination. Now to understand axis, we have to remember the following. Cardiac axis refers the overall direction of ventricular depolarization, which is the algebraic sum of action potential traveling towards the apex of the heart on the left side. Now, what cardiac axis means? SA node starts depolarization, is the triggering point of depolarization. From there, the conductive tissue carry the action potential to the different parts of the heart and cause contraction and relaxation. Now, this cardiac axis means in what is the mean, that is sum total algebraic sum of action potential, which is traveling towards the apex on the left side. So is a force of action potential that is passing towards the left side and it is recorded. This is known as axis of the heart. Now we should further try to understand the position of the heart in thoracic cavity. Heart is not a vertically placed organ, but it is twisted and is more on the left side. Then another very important fact to be known is anterior surface of the heart is made up of right ventricle. That means most anterior part of the heart which is touching the thoracic wall is the anterior surface of the right ventricle, while the left ventricle is posteriorly placed and only a small part, that is tip of the heart, is present on the left side in fifth intercostal space in the mid-axillary line. Ventricle is seen anterior right ventricle, the left ventricle we know. So right ventricle forms the anterior surface. Posterior surface of the heart is behind the right ventricle. Posterior surface of the heart is behind the right ventricle. Only apex of the ventricle, left ventricle, only part of the left ventricle is seen anteriorly, and that forms the apex of the heart. So what should be the definition of apex of the heart? Apex of the heart is outermost, lowermost part of the heart in the fifth left intercostal space. Then the next question that arises is, what is axis? Axis is calculated from the record of electrical activity in the frontal axis, and that is, frontal axis means what? The lead 1, lead 2, lead 3, AVR, AVL and AVF forms the frontal axis. So axis is calculated from the frontal axis with the measurement of height of the QRS wave in lead 1, lead 3 or AVF, and this is the way how we measure. So in other words, the axis of the heart, the main axis of the heart is in the direction of, is measured with the help of, or determined with the help of QRS, and it will be most appropriate to call cardiac axis as axis determination or calculation of QRS electrical activity. Then you will come across with another word, that is vector. Now what is vector? Vector records both direction and magnitude of the electrical activity at one point. So this is the difference between vector and axis. Now we carry on how to measure axis.